The most historic upgrade to veteran health care is now in place. The PACT Act changes the world for millions of veterans who fought hard for benefits. And today, Todd Sledge, the Chief Public Affairs Officer at Cincinnati VA Medical Center, is here to tell us more about this. Good morning, Todd.
Morning. It's great to be here.
So what is the VA PACT Act and why is it so important?
Well, the PACT Act is so important to veterans because it's the largest legislative change in VA's history, especially in my 30 years in VA, where it's expanded VA health care broadly, not only for compensation and benefits, but for health care benefits, where veterans previously, maybe 10, 15, 20 years ago, might have been told they couldn't be eligible for health care or per a presumptive condition related to toxic exposures. Now all this window is made more wide open and more available to veterans. We want to make sure they get plugged into it.
So when did the PACT Act go into effect?
Well, it went into effect last August 2022. That the law went into effect right about December or January. After we learned more of the components of everything, we started doing vast outreach to veterans, social media, TV, radio, to get veterans plugged into this. And it's been really successful, but there's a lot more veterans in the tri-state that need to know about it.
Well, I know we want to get the word out there, too. What are some of those key components in the PACT Act?
Well, the key component is that now, instead of the veteran having to prove that they were exposed to toxic exposures, VA has this large presumptive list. So it's basically sitting down with an expert that does disability claims, filing these claims around exposures, air, water, pollutants, asbestos, wherever you think. If you're in the military, you were around some kind of substance, what it might be. So we want veterans to be aware of those things, and because some of these things like dermatology, emphysema, diabetes, heart conditions, they're all related, and veterans need to be plugging into these benefits because they could be having prolonged conditions of health care to help solve some of these problems or help get some solutions.
Well, I know you touched on it briefly there. So what exactly is toxic exposure? What does that mean?
Well, it can be a variety of things. It can be from fuel from airplanes. It can be from Agent Orange. Agent Orange is a big one, obviously. Different contaminants, burn pits. That's the big one back, with Gulf War and post 9/11 veterans. So anything that was, basically provided some kind of toxic substance, we want veterans to get those answers for those things. We're doing toxic screenings at the medical center. We've screened about 22,000 veterans already, and so to lean towards what those things look like in the conditions of health care and also their disability claims, we have all these experts and teams around that to look at that. But the exposures can really be anything. So again, let the experts decide what they are instead of presuming that you might not have been exposed to something, but come talk to us.
And Todd, how does the PACT Act expand VA healthcare eligibility?
Well, this is what's very important. So, when you hear that you might be eligible to get some more money from someone, especially this, there are disability compensation components that are relevant to this, but the big part is how it expands your healthcare services. So for a service-connected veteran who might be receiving a certain percentage of 0, 10, 20, or 30%, that percentage could be increased, which means long-term care benefits, different kind of components to healthcare that they're accessible to, and other related medical conditions where it doesn't cost them anything at all, to provide those healthcare services.
So, Todd, what has the Cincinnati VA Medical Center been doing since August of 2022, basically, to help veterans understand this law?
Well, besides what we started pushing out, mailers, the typical email blasts, postcards, doing a lot of radio commercials, trying to get as much information like this done. We've also started back this past May and June. We've deployed our mobile unit out to the community, so we're going out to veterans saying, come see us, talk to our experts about filing a claim, getting enrolled in VA healthcare, and also if you've not used us in a couple years, say 12 to 14 months, we have a team that can say, we know exactly who you saw, what your last appointment, and let's get you rescheduled. So we do that on Wednesdays out in our different communities, and you can find this list of events where we're at on Cincinnati..VA.gov under our events tab.
All right. Well, I know we covered a lot here, Todd, with the PACT Act. If people want to learn more about this, we want to get this information to our veterans. How can they do that?
Well, the best thing to do is first call our eligibility office at 513-475-6499. if you're not enrolled in VA healthcare. The other thing too is to talk to if you are enrolled, is to talk to your primary care provider about a toxic exposure screening, which is, the PACT Act stands for the Promise to Address Toxic Exposures. And talk to your primary care provider. We also have an informational center right in the entrance of the medical center about all the toxic exposures as well. And talk to your Veteran County Service Commission offices as well. So there's a lot of things that are available to veterans.
All right, and good that we can get the word out on that too, Todd. Thanks so much for talking with us today.
Absolutely great to be here.